I haven't really done very much or thought about it too much, so like not a lot, like maybe eating a little bit healthier, but
It's a strange thought for me to think there will come a time, or there might come a time, when I have to pay strangers to take care of like basic functions for myself. That's an idea I still don't really know how to process that.
Think that I'm gonna be in like some like hip, cool, like old retirement community, and I definitely will be the one leading the icebreakers and name games and that kind of stuff, because I feel like that's just been my life, and that's what I'm gonna always remember, right? So that's yeah, it's a it stresses me out sometimes to like stop and think about it.
With the growing diversity of older populations, there has been an increase in aging assistance options. Yet knowledge of these alternatives is limited, and often economic class predicts availability. Those with low income are more likely to have lower perception of their quality of housing, neighborhood safety, and self-rated health. A high proportion of those with low income live in rural areas. In Huntington, Pennsylvania, 14.3% of the population is living in poverty, and 14.9% of the population is 65 and over. We decided to look at the care options in Huntington to get an idea of awareness of aging services and perceptions of aging.
The in-home nursing observed in the Huntington area were included helpmates, comfort keepers, and home instead, all of which include typical home care, which is bathing, dressing, shaving, and activities of that nature. Other services include meal preparation, shopping, light housekeeping, escorting services to appointments, shopping, companionship, and medication prompting. Some differences highlighted were Home Instead had specific services for hospice, Alzheimer's care, arthritis, diabetes, and other dementias. Costs were differing. Comfort Keepers is quoted saying, although rates are varied, long-term care.gov estimates nursing home costs over $6,000 per month, and in-home is generally far less expensive, but will vary on the care needed. Some pros related to in-home care include living in their own home and aging in familiar environments. You could be living near features already necessary for aging, such as hospitals. The loneliness is lessened based on communities that help you grow and to keep elderly people in contact with younger people, versus the difficulties and costs made in home adaptations to current living spaces.
Another option for older adults includes adult day services. This is a useful service for individuals who have caretakers that work during the day, or for individuals who no longer work but still want to enjoy the company of others. In the Huntington area, the options include senior centers such as Standing Stone Senior Center and Juniata Valley Senior Center. These centers are open from 8 a.m. to 2 p.m. Monday through Friday. It is free to attend the center and participate in the activities at a low fee of $2 per day for lunch if you're 60 years or older. There are many activities offered at the centers, such as exercise classes, art, bingo, choir, and weekly educators. Currently, there's a 10-week cultural education program held at the centers that is available for all community members. Each week there's a session about a different decade, and participants have the chance to learn about art, fashion, economics, dance, and music from the time period. There's also a dance party where the community can dress in clothes from a decade of choice and practice their dance moves. Senior centers are funded by the government, local businesses, and donations, so cost does not need to be a concern for older adults, as long as the centers receive adequate funding. These centers are a great option for individuals living below the poverty line. There are also relatively cheap transportation services for seniors who no longer drive. Huntington does not have a good public transportation system, but through the shared ride programs, seniors are able to get to their medical appointments, go shopping, and get to the senior centers for little money. CART is a transportation service available to the entire public, but seniors 65 and older are eligible for a discounted price. They have to pay less than $2 for one-way transportation within Huntington, Fulton, and Bedford. However, individuals who use CART have reported that the transportation system can be unreliable, and of course, the cost for using CART and eating lunch at the senior center can add up, and participants can end up paying around $1,500 a year. However, there are many benefits that can outweigh the cost. Research has shown that the benefits of attending senior centers include reduced risk for depression, heart disease, diabetes, and cancer. Individuals report having a stronger feeling of social connectedness. These factors result in longer life expectancy. Overall, centers like Standing Stone Senior Center are inexpensive and provide both the elderly and the community many benefits.
The final option we explored was continuing care retirement communities. They provide older adults with services from time of entry to time of death and have differing levels of care. Most people start an independent, having their own home on site, go to assisted with some care provided, and finally licensed with round-the-clock care. In Huntingdon, the embodiment of this is Westminster Woods. They provide options for residential living, including apartments and villas, and offer some home and memory support services throughout all levels of care. Although continuing care facilities are attractive options, they are expensive, with a large entrance fee and monthly maintenance fees. Westminster Woods accepts Medicare and Medicaid for skilled nursing services, but not personal care. If you happen to run out of resources while there, you can apply for help but must be eligible for medical assistance. You are required to have renter's insurance for personal property, and it's also recommended you have long-term care insurance to help cover the costs for healthcare services. Continuing care facilities cover the entire continuum of care in one location, including home maintenance such as repairs, housekeeping, meals, snow removal, lawn care, etc. They design programs to encourage personal enrichment through opportunities to get involved in things like clubs, technology classes, and book groups. Other services include fitness centers, transportation, and dining options. It's important to encourage socialization, as seniors who live in isolation tend to have a more rapid health decline. The downside to continuing care facilities is that they are one of the most expensive options, so it isn't viable for low-income households. There are long waiting lists, expensive fees, and they limit your ability to make your own decisions. For example, you must ask before making any changes to your home, such as upgrading appliances or installing new carpeting. They limit the number of pets you can have, and there's no smoking on the property. Overall, although there are some cons to these services, continuing care facilities are excellent options for some elders.
I kind of knew that those were there, but not to the extent that y'all just told me about, so.
Well, you guys were kind of right. Like, you should start thinking about it and saving. I didn't think really about that part of it, that aspect of it, but like the financial toll it takes.
I'm sort of accepting the fact, that I'm becoming a senior citizen.
Overall, the promotion of healthy aging is important. Many of the people in Huntingdon meet the risk factors for unhealthy aging. Living in a rural area, having low income and limited resources, a small social circle, and being a member of a vulnerable group such as a low economic position. Keeping elders from isolation, increasing community outreach at a young age, and letting people know their options for care can make the aging process easier for everyone.